Hello, this is Kathy Bukowski, the owner of the CB Health Insurance YouTube channel, and today's video is going to cover don't make this Medicare enrollment mistake. What are we talking about? If you're new to Medicare and enrolling for the first time, or if you recently enrolled and made this mistake, I'm going to tell you how to fix it. What are we talking about? First and foremost, welcome to our YouTube channel. If you are new to our channel and visiting for the first time, don't forget to subscribe, hit the little bell so you'll get notifications when we release future videos. Be sure to tell your family and friends, give us a thumbs up, and leave us a comment if you have comments in below. Now, on to today's video. Don't make this Medicare enrollment mistake. What are we talking about? Drug coverage. There are a lot of people turning 65 who are very healthy. People are living a lot longer. They're exercising, they're working out, they're traveling, hopefully after COVID and they get their vaccination, they are traveling and they take no medications. And so some people will say, don't enroll in Part D drug coverage because you don't need it. You can enroll later. Don't do that. That's the mistake, is not taking any type of Part D coverage. And let me tell you why. There are two reasons you don't want to do this. The first one is you will pay a penalty. By the way, the late penalty that's tacked on when you do enroll later is a penalty for the rest of your life, forever. So what is the penalty? Well, the penalty is for every month you delay being enrolled in some sort of qualified Part D coverage, or it could be also under Part C, or if you're a veteran, you can have, through the VA, some veterans do qualify for drug coverage. Not everybody, so you have to make sure you have the qualified plan. If you are without coverage, without any credible coverage, and you just decide to delay, you will pay a penalty, 1% for every month delay. So let's do the math real quick. And it's based on, the penalty is based on a national average. So if you delay for a year, that's 12%. If you delay for 5 years, that's 60%. Now 60% of what? What are we talking about? It's a national average, and the government sets it across the country, and it's been anywhere from, $32 up to $34. It's kind of around there, but we'll just use right in the middle. We'll use $33 as a national average for any Part D standalone drug coverage. So we take that $33 and we multiply it. Let's say you delayed for 5 years. You're pretty healthy, you retired at age 65, you say I don't need drug coverage, and you wait to age 70 to enroll. Now, that's an extra 60% because it's 1% per month, 12% for 1 year, right? Times 5 is 60%. I've actually done the math in advance with my handy calculator because I can't do it up here. And what that comes out to is 33 times 0.6 is $19.80 per month. Per month on top of the cost of the drug card. So that's another $20 a month almost for the rest of your life if you delay by 5 years. If you delay by 10 years, it's double that. And it's whatever they set the national average at the time. So 10 years from now, the national average might be $50 a month. We don't know. When you do the math, that's an extra $237 a year, or over 10 years, and you could live longer, you're going to pay over $2,300 extra in a late penalty for the rest of your life because you delayed enrolling. So that's the first mistake. If you delay enrolling, you will pay a penalty. The first reason not to delay. Now, some people say to me, well, you know what? That's not a big deal. I have the money. I'd rather take the risk. I'm going to roll the dice. I'm going to go without drug coverage. I can pay the late penalty. Not a big deal. I'll deal with that later. Kick the can down the road. Well, there's a second reason that you do not want to delay. And to me, this is the more important reason, okay? Recently, we had somebody call our office and say, don't do Part D coverage. You can just enroll later when you need it, but you can't. So The second reason why you want to sign up right away is when you are ready to sign up, you will not be able to enroll at any time during the year. You will have to wait to the annual open enrollment. Now, why is this a problem? Well, let's say you're going along and you're pretty healthy, you've gone 5 years without drug coverage, and all of a sudden, boom, you get a diagnosis, a major health issue. You have a heart attack, you have a cardiac event, you're diagnosed with cancer, okay? And if that diagnosis comes in the beginning of the year or the middle of the year, and now the doctor is saying, I want you to take this $1,000 a month prescription medication for the rest of your life, or this latest, greatest, newfangled drug, which has shown to combat this type of disease, but oh, by the way, it costs thousands of dollars a month, you will not be able to enroll in a Medicare drug coverage at that time. You're going to have to wait till the end of the year to the annual open enrollment, which happens October 15th through December 7th. October 15th through December 7th is the annual open enrollment, and your coverage will begin the following year. I did have somebody in all the years I've been doing this, which is over 30, we did have somebody delay, and it was, she said, well, I'm healthy, and she actually went about 15 or 16 years, and she was looking at a pretty hefty, so what did I say, $20 for 5 years times 3. She was looking at an extra $60 a month. The problem was over the summer, she had gone to the doctor, and because of stress and some other things, they said, you've got some heart issues going on. You need to take some medications. So she went to the fill the prescriptions, and they were hundreds of dollars a month. So she said, I'm gonna wait. Problem was, before we could even enroll her, she had a major cardiac event, which really affected her life. And she was unable to, long story short, enroll in a Part D drug coverage at any given time. So 2 reasons that you do not want to make this mistake. What's the mistake? Skipping out on the drug coverage. Oh, I'll sign up later. I'm healthy. First one is you're going to pay a penalty for the rest of your life. The second reason is that you can't enroll at any time. So if you get diagnosed with something and the doctor's saying you need to take this expensive medication that's only covered under drug coverage, outpatient drug coverage, you're going to have to wait till the annual open enrollment. So if you know anybody that has not signed up for this Part D coverage, make sure that they do that at the next open enrollment. If you are turning 65 and enrolling in Medicare for the first time, make sure you have some sort of drug coverage, whether it's Part D or Medicare Part C, a Medicare Advantage plan with prescription drug coverage. We hope you found this video helpful. Stay tuned for future videos that we release, about 2 a month. Make sure that you've been subscribed and you hit that little bell so you will know. Tell your family and friends, and until next time, this is Kathy Bukowski, owner of CB Health Insurance, signing off. Have a great day.